swaying or inability to maintain balance while standing with the eyes closed is considered a positive finding in what test? A. Romberg's test. B. Test for ataxia. C. Gait test. D. Rapidly alternating movement test. The answer is A. Romberg's test. Romberg's test is an evaluation of both proprioception and vestibular function. The patient is asked to stand with eyes open, then to close their eyes and remain still. Any tilting or loss of balance is considered to be a sign of either proprioceptive or vestibular impairment, and should be evaluated further. Gait test assesses for gait abnormalities. Rapidly alternating movement test is done with the patient seated with their hands on their thighs. They are asked to rapidly turn their hands over, then return them palms down to their thighs 10 times. This test is evaluating for dysdiadochokinesis, or inability to perform rapidly alternating movements. Ataxia, or the loss of control of bodily movements, is not a specific test, but rather a clinical finding. A 46-year-old patient presents with dysdiadochokinesis, an inability to perform rapidly alternating movements. What condition is the most common cause of dysdiadochokinesis in adults? A. Lesion in the pons. B. Multiple sclerosis. C. Parkinson's disease. D. Cerebellar lesion. The answer is B. Multiple sclerosis. In adults, the most common cause of dysdiadochokinesia is multiple sclerosis. Cerebellar lesion is the most common cause of this finding in children. This symptom is not a normal finding in Parkinson's disease, or in pontine gliomas, tumors of the pons, though neurological impairment or ataxia itself may make rapidly alternating movements difficult. A 26-year-old woman presents to urgent care after a bike accident in which she got a bad bump on the head. She was not wearing a helmet. She must now be assessed for increased intracranial pressure. All of the following are signs of increased intracranial pressure except dash. A. Effort-related or positional headache. B. Altered consciousness. C. Migraine or that persists after headache has resolved. D. One or both pupils are dilated and unresponsive to light. The answer is C. Migraine or that persists after headache has resolved. Increased intracranial pressure can be chronic or acute. The nurse must assess for pupillary response, level of consciousness, and quality of headache if present, in addition to motor response. Migraine or that persists after headache has resolved should be evaluated for stroke, transient ischemic attack, or arteriovenous malformation. Which of the following terms denotes neurological impairment of the ability to speak or understand language? A. Apraxia. B. Ataxia. C. Dysmetria. D. Aphasia. The answer is D. Aphasia. Aphasia is the term for neurological impairment of a person's ability to speak or understand language. The other terms listed all denote various deficiencies. Ataxia is a loss or lack of coordinated motor function. Apraxia describes the lack of motor planning or inability to execute a specific intentional movement. Dysmetria is an inability to judge distance when attempting movements such as grasping at a nearby object. The nurse cares for a patient who is prescribed phenytoin for seizures. Which of the following serum drug levels would most concern the nurse? A. 10 microgram per milliliter. B. 12 microgram per milliliter. C. 20 microgram per milliliter. D. 16 microgram per milliliter. E. 8 microgram per milliliter. The answer is E. 8 microgram per milliliter. The therapeutic serum phenytoin level is between 10 to 20 microgram per milliliter. 8 microgram per milliliter would be below the therapeutic level and may be due to non-compliance by the client or increased metabolism of the drug. The other options are within the listed therapeutic range. Which of the following is a term for an abnormal surge or excess of electrical activity in the brain? A. Dyskinesia. B. Twitch. C. Spasm. D. Seizure. The answer is D. Seizure. A seizure is defined as an abnormal surge or excess of electrical activity in the brain. This can result in partial or total loss of consciousness, and may cause muscular spasms, twitches, or other types of dyskinesia, disorders of movement. Spasms, twitches, and dyskinesias are not always caused by seizure disorders, however, they may be caused by a wide range of neuromuscular dysfunctions. Schizophrenic individuals frequently have abnormally high levels of what signaling molecule? A. Serotonin. B. Acetylcholine. C. Norepinephrine. D. Dopamine. The answer is D. Dopamine. While many people with schizophrenia do seem to have dysfunctions in multiple signaling molecules, excess levels of dopamine have been clearly associated with this disorder. Hank is a schizophrenic 46-year-old male. He experiences a persistent belief that a particular television commercial actor is addressing him directly, and that the commercial was created specifically to communicate with him. What type of delusion is Hank experiencing? A. Delusion of control. B. Erotomania. C. Delusion of reference. D. Kota or delusion. The answer is C. Delusion of reference. The belief that general or innocuous events exist specifically for or relate specifically to an individual is called a delusion of reference. Examples include belief that a billboard or television commercial is attempting to communicate directly to an individual, the ascribing of significance to random coincidences, or the observation of coded signals or signs in the general environment. Charlotte is a 19-year-old female with new onset of paranoia and auditory hallucinations. She has a positive family history for schizophrenia. Recently she admitted to her nurse that she can hear what other people are thinking. As she describes it, this does not come in the form of sound, but is communicated directly to her brain. Charlotte is likely experiencing which of the following? A. Thought broadcasting. B. Auditory hallucination. C. Telepathy. D. Delusions of persecution. The answer is A. Thought broadcasting. The belief that other people can hear one's thoughts is described by the term thought broadcasting. This is a common symptom in schizophrenia. It is differentiated from telepathy in that thought broadcasting, there is a delusion that thoughts can be heard by anyone, while telepathy is generally nonverbal communication between specific individuals, and may be receptive as well as projective. Auditory hallucinations are false perceptions of sounds, or internal thought perceived as emanating from another source, While delusions of persecution can take many forms but generally include a degree of paranoia or feeling of being targeted for harm or attack. The term positive symptoms in schizophrenia refers to which of the following? A. The loss of a specific sense, such as loss of sense of smell, anosmia. B. Any cognitive excess or distortions, such as delusions or hallucinations. C. Any symptom that increases confidence or leads to grandiosity. D. Repetitive physical movements or gestures. The answer is B. Any cognitive excess or distortions, such as delusions or hallucinations. Positive symptoms in schizophrenia are any symptoms of cognitive excess or disordered thinking. These include delusions, such as delusions of grandeur or persecution, hallucinations, and disorganized speech or behavior.